Good evening, everyone. Happy Tuesday. Hope you're all comfortable in your favorite Zoom room again. 10th meeting. We're in double digits now, so and thank you for all of your perseverance. As we noted that, the master plan is in the long haul. We're probably close to, I don't know, I'm not going to say halfway, but at least 10 meetings in. So welcome committee members, MAPC, and of course, members of the community that took their time to join us. We're so thankful for all of your attendance. I'm Jeremy Rosenberger, Planning Director for the town of Dedham. This is the town's master plan, which we conduct every 10 years, and it's to provide a strategy towards a number of topics related to economic development, housing, transportation, livability, jobs, public health, which we're talking about tonight. And, I think we can all attest to way back in November when we first got this going that by no means do we understand what an idea or what a concept or what public health would have in our everyday lives at this level. So, and from the outset, this was one of the recommendations of the Master Plan Implementation Committee that preceded this, that public health should become to the forefront of a master planning process whether it's a topic, whether it's an overarching principle of how Dedham comes and develops this master plan, public health should be intertwined amongst all of our conversations. And I think we've all realized what a role that public health is in our everyday lives. And I think we can all attest that public health is, envisioned in each one of these topics that we've talked about tonight. And so probably new to everyone is having a discourse on what does public health mean? And is it a topic? Is it overarching principle through this master plan process? And ultimately, how does it weave its way through this master plan process? And ultimately, what do we want to see out of public health when it comes to this master plan? And thank you, MAPC, for hosting this tonight and conducting some breakout groups. I look forward to some great discussions. And I'll pass the mic to Josh, MAPC, or co-chairs if you have anything to say.
All right, I was just maybe pause. Jessica or Sarah, did you all want to add anything to that?
No, just excited for this conversation. I'm really excited to see so many committee members and also members of the public here. So thanks, everybody.
Yeah, particularly timely and excited to get in a breakout and dive in a bit.
Great, thank you both for that. Thank you, Jeremy, for the introduction. Elaine, if you might advance a slide. So I'm Josh Fiala, Principal Planner at MAPC. Good to see you all again on our 10th meeting. We all know each other pretty well now. We also know these front end slides pretty well. You probably all have them memorized by now. So we're on Zoom protocols, although we should have updated this slide a little bit because we're in a Zoom meeting tonight, not a Zoom webinar. So you might feel loose with less security protocols, but we can all see each other, and communities or members of the community at large can see everyone else. So that's a good thing. But we are still recording this meeting. It will be posted on the project website, designingdedham2030.org. If you could, please mute your audio if you're not speaking. Of course, there will be opportunities for people to participate, both committee members and members of the public, and we'll welcome you to do that and unmute you at those appropriate times. You can also use the chat function if you'd like to get our attention, or the raise your hand feature, any of those along the way. But we do have some built-in engagement portions of this meeting as well. Next slide. So our meeting agenda for this evening is to really focus on public health and livability. And we have Elaine Zhang, a public health planner at MAPC, joining us for that. Also joined by Carolina Prieto, a familiar face, our community engagement specialist at MAPC for the project. We're going to have a few updates about some other items going on, the draft one-sheet summaries and the community engagement update, which is about the posters and some other business. We'll get that to you in short order, and then we'll have some brief next steps. But the focus really in the majority of the meeting will be devoted to the public health and livability agenda item. Next slide, please, Elaine. So with each of the presentations, we've also presented these values and expectations, which the committee put forward in their very first meeting and has been using them to guide each of the conversations that we've taken on. So this is the 10th of those, and I think we've followed these pretty closely along the way. So we'll continue to keep these in mind as we engage around the discussion this evening and look to continue that open-mindedness and respect particularly. All right, next slide, Elaine. And next slide. All right, so this, if you are a member of the public viewing this, and maybe this is your first Master Plan Steering Committee meeting you're attending, the steering committee members are on the screen. Many of them have their videos on and available. They're representing a variety of planning board, or a variety, not planning board is one of the committees that boards that they're representing, but they're representing a variety of boards and committees across the town, and have been selected by the select board and the planning board strategically to be representative of many different viewpoints within the town. And so we've been very pleased to have them along for this process and are continually impressed by their insights and thoughtfulness as we've engaged in a number of topics to date. So next slide, please, Elaine. And now we just wanted to share briefly with the committee a little bit about draft one-sheet summaries, which you'll start to see in more concrete form soon. We've been talking about them as this idea on the horizon, but that horizon is getting closer and closer. So you could go to the next slide, Elaine. We have some previews of them, which are a little too small for you to read, but they are being reviewed by Jeremy and the co-chairs. Currently, we have a draft of a summary of the existing conditions, the community survey responses, and the draft goals for economic development in transportation and connectivity. So these follow very closely, actually, the presentations which we had on those two subjects a few months back. And now what we're doing is concretizing that information in these one-sheet summaries that can then be distributed to a broader audience. Before we do that, we'll give you all a chance on the committee to take a look at them and give us any feedback and insights about revisions for clarity or other thoughts where you might want to see some changes before they go fully public. But then the intention is to use these one-sheet summaries to engage the Dedham community prior to community open houses, which have been scheduled now. We'll share those dates with you all in this meeting tonight, but they'll be used as a part of that outreach. And then the conversations in those open houses will actually be centered around the information on these one-sheet summaries. So all of that ties together and will hopefully help people to follow along with the content as it begins to take shape. By no means are we near the end of producing content in this planning process, but really we're starting to define the high-level goals for each of the topic areas, which sets a very solid direction for us. All right, and I'll just reiterate, this is all based upon the conversations which you've all been a part of as the committee members with each of these topic area discussions. And so we're starting with the first two sessions we did, economic development and transportation, but we'll repeat this process for housing, for public health and livability, in each of the sessions that we have from here through the beginning of the year, 2021, that is. All right, Elaine, next slide, please. Oh, Jeremy, did you want to say something about this?
Andrew? Oh, I've got myself on mute. I just wanted to ask when we would get those one-sheet summaries for review.
Yeah, so I think pretty soon. We just sent them within the past day or two to the co-chairs and to Jeremy. So they're taking a quick look at them just to make sure that they sort of fit with expectations. And then once that first review is completed, we'll send them along to the committee for a next sort of, we'll call it another internal review before it goes broadly public.
I had a moment of panic preparing for this meeting, thinking that they were there somewhere and I ought to be looking at them. So you've relieved me.
No, you don't have them yet, unless you're plugged in ways that we're not expecting. So you will get them shortly. Probably, I would guess, within maybe the next week or so. And then the idea there also in terms of the timeline is that we would get comments or other thoughts back from the committee in, say, another week and a half to give ourselves a good solid lead up to the first virtual community open house, which would give us time to put these out on the website and to start pushing them out to various stakeholder groups. And this is a slide which we've been using to remind ourselves of this overall hierarchy that we're working on. The vision statement will continue to mature and we'll get that shaped up and eventually onto its own one-sheet summary. And then each of the topic goals we're starting to frame out through these discussions. And then subsequent to getting the goals sort of beginning to be solidified, we'll be filling out strategies and actions underneath each of the topics in such a way that hopefully all of this starts to bind and interweave as an entire coordinated plan across all topics. All right, Elaine, next slide, please. And then this is a reminder that we're about halfway through these topic area discussions. So this evening, again, we're in the public health and livability. Next up is natural, cultural, and historic resources in November, land use in December, and then January will be our only shared meeting, but it's actually two very closely related topics, the community service and facilities and governance. So that is the rest of our schedule in this series of topic related meetings with the committee. So we have a few more months left in this mode of operation. All right, Elaine, next slide, please. Now I'm going to hand it over to Carolina to give us a brief update on some of the highlights that have been happening with the community engagement.
Hi, everyone. My name is Carolina Prieto. I'm the Community Engagement Manager at MAPC. Happy to give this update. Good to see everybody tonight. Just a high-level quick update on engagement. So first of all, I just want to thank everybody for all of your contribution and support with the poster campaign, going to pick up different posters, signage, being able to go around town and dropping things off, putting things up. I want to give a big shout out to Jess and Michelle, Sarah, and the outreach working group as well, who also participated and was coordinating this effort. Next slide, please, Elaine. Thanks. So I'm actually going to give a quick update on our website impressions. We've been working with our comms team. Wanted to just give you a quick update. We've had about 2,000, a little over 2,000 page views since March for the website. And actually, about 1,200 of those directly coming from Dedham IP addresses, which has been really great to see. About 13 or so individual users of the website and top traffic direction from the town of the Dedham town website, Qualtrics, and then Facebook. So those have been sort of where people are filtering into the project page. And so just a kudos and effort to those who have been sharing information out to their networks via Facebook and other ways through your email updates, etc. It's really helping us to get more traction amongst the town and to get more involvement in the process. So it's just nice to see that as well. Next slide. So just a quick, I kind of started this already, but the implementation of the posters, as you know, and I think it's been a really great addition to see also the lawn signs being able to be put up in different areas of town. Just a really nice addition to just the original poster idea. So I think that has been a great, contribution. Next slide. So from the poster campaign, we've had about 50 inquiries and about 12 responses through the online portal. And we've had some also just 6 text message responses, but it's been nice to see that we've had at least an introduction to text messaging for maybe those that aren't directly linking to the website. And so I just wanted to share a couple of participant quotes here. Dedham's history lives in many places, but none more important than the people and the neighborhoods. And I think, Dan really shared that really well with the group. And I wanted to highlight that as an important piece as we're having those additional discussions about history. And those have come up a lot in the working group and the committee as well. Another participant said, I truly wish Dedham was a safe and walkable community. There are many roads I do not feel safe walking with my family dog on during the day because of traffic. Does not pay attention to pedestrians. So just an additional conversation point that we've been having around safety and walkability. And I think something that will continue to come up as we're thinking about also public health and the ways we can integrate that into the planning process, as Elaine will talk about today. So I wanted to give folks an opportunity just to share how people are feeling in terms of what you're hearing about the poster campaign, how you think it's maybe gaining visibility for the plan. And so I just wanted to pause and see if there are any comments from anybody in the committee or others that wanted to share. So just a couple of minutes to pause here. And you can also feel free to use the chat if you're in the middle of something too that's happening in your home. Feel free to share in the chat as well, but we'd just love to hear any impressions so far. Awesome. So Jess says that she's heard great buzz from people.
Carolina, do we have a sense if the posters are all out on display in the public spaces that we expected? And are they all out at this point?
That's a good question. I might pass it over to Michelle. Michelle, do you have an update on that from the distribution section? I know that you were working on that with Jess in terms of distribution.
Yeah, so I believe we've had about 20 or so, maybe a little over 20 committee members and working group members that went around the town and distributed. So again, just reiterating what Carolina said, thank you so much. This wouldn't be possible without your efforts, so highly appreciate that. So in terms of distribution, I believe we have just about all of them. I think we're waiting on one other person to pick up their poster materials, but majority are right out the door.
Awesome, thank you.
Mm-hmm.
Great.
Carolina,
Shaw says, I've gotten some great feedback on the quality of the designs on the signs. That's great to hear, Shaw. Thank you for that sharing. And if folks also, throughout this continued process, if there are additional things that you're hearing, I would love to hear it. Or if there are any specific stories that people want to highlight based on that, to connect to me, and I'd love to hear it, share that back out either on our project page or on our Facebook posting. Jeremy, did you have a comment or question?
Yeah, I just want to make a note if folks want more materials. I think we have like 4 lawn signs left, but if you want posters laminated or 11 by 17, please let Michelle know. We're happy to print them in-house and get you whatever you need.
Awesome. Thanks, Jeremy. Appreciate that. Jess says to check the original list and compare what is already out. Maybe that Riverdale could use a sign or 2 at the school. So maybe, Michelle, we can connect with the outreach working group on that piece and check in when we do our check-in next week. Awesome. Next slide. So we are excited, and actually, Josh, do you want me to hand it back to you so you can share? Yeah.
Sure. Thanks, Carolina. So yeah, I'll reiterate, we are excited. So we are looking forward to a more public discussion of the topics like we've been having with the committee. And to do that, we've set up a series of 3 virtual community open houses, which will be hosted on Zoom. And they'll follow in the model that we've been doing in the committee. So they would be 3 sessions that are devoted to a series of topics. So the first would be economic development and transportation, which you're getting the 1-sheeters for shortly. And then we would be talking about housing, and that's in December, on December 7th at 7 p.m. evening meeting. And then on housing, public health, livability, natural, cultural, and historic resources in January. So after we've gone through these discussions with the committee, and that would be on January 26th at 7. And then out in March, after we've done these additional conversations, we'd be talking about land use, municipal facilities and services, and governance on March 23rd at 7. So we think this is a nice sort of mirror of a public conversation similar to ones we've been having as a committee, to invite discussion and thoughtful critique around the topics and how these goals are starting to shape up. So everything, of course, is still in draft form, but I think it's a nice place for us to invite that commentary from the public, because we'll be starting to define a direction in each of the topics. So it won't just be an open call for discussion, but it will be more directed, and people can give us early feedback and response to what they're seeing in those early directions. And that will give us ample time to adjust or correct as needed from what we're hearing. So we think this is a great format and a great way to do this. And the format of those meetings themselves will basically be to divide each of those sessions into two or three sections of a discussion, which everyone will be a part of. And then we'll have a brief presentation similar to the presentations you've been getting as a committee around the topic, introducing the important data and analysis that's been shared with you, framing those goals, and then inviting people to engage in that information, probably through a combination of poll everywhere and breakout groups. So we're still designing those sessions a little bit, but it will be I think a really fruitful discussion with the community at large. And we will be promoting these 3 dates as a series all together. So if they're interested in everything, that's wonderful. We'd love to have people come to all of them. But if they're interested in only one topic, is really, public health is their focus, then they could join us on the 26th and know that they can do that and get that information. So we will be getting these dates pushed out in advance, starting, very soon. And we'll be getting that information out through a number of ways. Maybe I could pass it back to you, Carolina, to talk about things like the newsletter and some other approaches to get the word out.
Yeah, so we're setting up all of the advanced registrations right now. And so once we have those set up, we'll be sending it out to our mailing list, which is I think over 300 or 400 people. And then we'll be sending it out to our partners that you all helped us to create that list of potential partners and individuals that were key to share this out to. So we'll do a large kind of email blast out to people and sort of maintain sort of a marketing campaign around this, so that people know what's coming up, how they can register, and actually know ahead of time when these things will happen so they can plan to be there. So that's part of the plan. We'll have a little bit more comprehensive outreach strategy once we check in with the outreach group. And as always, if you have additional ideas or ways that we should be reaching out, I'm definitely open to hearing that. Or you can also connect me to people directly, and I can add them either to our list or to our mailing list, or connect with them individually if that's more preferable.
Great. Thank you, Carolina. Maybe Elaine, if you could advance us to the next slide, which I think is getting pretty close to your presentation. Oh, there we go. So at this point, I will hand it off to Elaine Zhang, our public health planner, to really give us the heart of our evening's discussion.
Great, thank you, Josh. And thank you everyone in the steering committee for inviting me here tonight to speak on behalf of Dedham's Master's Plan's first public health and livability element. Very excited to be here. So just a high-level overview of topics that I will be covering for tonight's presentation. I wanted to give some examples of some examples of other master plans that MAPC have been involved in for public health elements, moving into sort of a framework of how I plan to sort of integrate public health throughout the entire master plan with a social determinants of health framework, move into the survey results from the topic area surveys, and then into existing conditions from the other elements and honing in and drawing in the connections to why those elements are important and its connection to health. And then ending with the breakout groups that Josh mentioned earlier with defining the topic area goals for the public health element. So these are just some data sources that were used for this element. And as you'll see later on, some of the existing conditions that I will be presenting on draw heavily from sort of the previous presentations. A lot of the data sources are similar to the housing, transportation, economic presentations. So just to start off and give some examples and sort of lessons learned on the importance of why we include public health elements in master plans. The Revere Master Plan was the most recent master plan that the Public Health Department completed a public health element on. That was completed back in January 2020, so earlier this year. And previously, we also worked on the Sharon Master Plan, which was completed in mid-2019. And both of these were their own individual public health elements. Specifically for the Revere Master Plan, the goal of the public health element was to really understand the current health conditions and behaviors that Revere residents were facing and to sort of assess the risk and opportunities presented by the built, natural, and social environments, and then sought to identify where healthier outcomes could be achieved through community design and strategies. And so for the Sharon Master Plan, the inclusion of a public health element really provided a more holistic typical view to our typical planning elements. And through callouts and icons and interwoven throughout the entire master plan, public health effects and sort of the implications were highlighted among the element, and as a result is also able to direct people to more relevant and external resources. And I think across both of these plans and actually the other master plans that we've been involved on, with Wellesley as another example, as a result of including public health as an element, it was able to really rope in additional municipal and local stakeholders that aren't typically really involved in master planning processes. So for example, in both plans, the aging population and older adults really became an issue that needed to be addressed. And so as a result of that, the voices of the Council on Aging was able to provide feedback and were engaged in conversations with the Public Health Department, and which is really important because their perspectives otherwise might not have been included in a master plan. And I think lastly, the common thread across both of these master plans and other master plans that we've been involved on, it really highlights public health really connects all the other elements together, and it really creates that cohesiveness within a master plan. And additionally, also provides an opportunity to call out important factors within a community, such as health outcomes that wouldn't naturally come across in other elements. That's just a little bit of background of MAPC's experience with public health elements. So just to start off, I want to just film a little bit of a activity for everyone to participate in, and it's just more of a grounding exercise for my understanding, but just curious how everyone in the room would define health and what you consider health to be. And so there are two different ways to participate on the screen. You can either participate via online with that address, or you can text MAPC poll to 22333. And I'll give everyone a few minutes.
Josh or Carolina, can you guys put that in the chat, that link, if you don't mind?
give it 10 more seconds. So as results filter in, I can just sort of provide sort of what I'm seeing from steering committees and residents of Dedham. It's great to sort of see all these different responses of health and sort of what you all consider to be health. It's like you all read my mind in terms of what I was thinking, how I would define health. But I think for the purpose of this presentation and sort of moving forward and thinking about how we define health, I want to provide a definition from the World Health Organization, which is health is the state of complete physical, mental, and social well-being, which I think actually someone texted in, and not merely just the absence of disease or infirmity. And this definition of health really takes into account of the majority of everyday life that lead to health outcomes for people. With this definition in mind, when we start to explore why certain populations may experience worse health outcomes compared to other populations, specific factors within the social and physical environment start to come to light. And so previously, it was really common to assume that health is an outcome of a person's ability to access healthcare, see a doctor on a regular basis, or even having good genetics. And although these factors are really important to consider and factor in understanding health outcomes, a plethora of emerging research really indicates that how we build our environment affect the health and wellness of residents. And although these estimates that you see on the screen may not be exact, research suggests that health outcomes is often tied to the social, environmental, and behavioral factors within communities and within the context of that residents live, work, play, eat, worship, really everyday life. And so the relationship between health and planning is really further reinforced by data around chronic rates, chronic conditions, and leading causes of death within the US. If you analyze existing data, you'll see that US is really has been experiencing actually increased levels of chronic diseases such as obesity and diabetes, and as a result, are dying as a result of heart disease, stroke, and lower respiratory disease. But all of these diseases are highly preventable as they are a result of behaviors or choices or influences directly or indirectly from a community's surrounding environment. And so this is why planning and planners in turn can really have a huge impact on shaping the health outcomes, because they have the power and the influence to influence decisions being made around the built environment. And so when we really start to look into the factors within our built and social environment, such as housing, transportation, job security, economic development, crime and safety, really all of these factors within these two outer circles and the conditions within these factors, we start to examine what we call the social determinants of health that people and communities face. Additionally, when we try to examine why specific populations, neighborhoods, municipalities, or regions may experience difference in health outcomes or health inequities, it can often really be traced back to the conditions within the built environment. And I think just one thing I really want to highlight here, these factors within the circles that we see, the social determinants of health, really have a trickle-up effect. These factors really contribute into building a healthy society, in turn, a healthy environment to healthy communities, and in turn, really healthy people. With that, Josh, I'm going to turn it to you to see if you can pull up the video real quick. And just to highlight this, Josh is going to pull up a video.
Can you all hear that okay?
No, try that again.
Here's how this works. Meet Deb and Maria. They both have jobs, they're around the same age, they're both married, and they both have 2 kids. Deb lives in A-Town, while Maria lives in Bville, less than 1 mile away. They're similar in so many ways, but here's the thing. On average, residents of Bville will die more than 15 years sooner than the residents of A-Town. Why? Because where you live is about more than just your address. It's about your opportunities. For example, Deb and Maria's access to healthy options is really different. In A-Town, Deb's family is surrounded by healthy food options, including farmers markets, specialty shops, and grocery stores. The air in A-Town is cleaner and fresher, and there are lots of safe, clean parks where Deb can exercise and her children can play. A-Town has good public schools for Deb's kids and easy access to emergency and preventive health care. On the other hand, Bville has broken, badly lit sidewalks, and the parks are unsafe. The air is filled with truck exhausts from the nearby highway. And for food options, Maria's only choices are Bville's many liquor stores, fast food places, or convenience stores. The schools in Bville are overcrowded and undersupported. And even if Maria can get her kids into better schools far away, she needs to figure out how to get them there without access to a car. So for Maria, having to juggle so much to find healthy options can be an overwhelming source of chronic stress, which is a serious health risk factor. In fact, for all the residents of Bville, chronic stress drives health problems like obesity, diabetes, asthma, and heart disease. How did A-Town and Bville get so different?
Thank you,
Well,
Josh.
in many cases in cities and towns.
You're welcome.
And so, just to further highlight an example of that picture that was just depicted in that video, this is a research that actually came out of Virginia Commonwealth University from 2012. And in this research, it found that Roxbury residents within Boston, the neighborhood, had a life expectancy of 59 years, less than half a mile away across Mass Ave. Within the Back Bay neighborhood, residents had a life expectancy of 92 years. That is a 23-year difference. And when you start to examine why there's such a big discrepancy in life expectancy between Roxbury and Back Bay residents, the research found that Roxbury residents identified everyday access to healthy food options, safe places for them to exercise, good paying jobs, stable and safe homes. And additionally, Roxbury residents also shared that they were also way more likely to skip out on preventative and regular doctor's appointments because they couldn't afford to miss work. And so between this video and this research coming out of VCU and looking into life expectancy within Boston neighborhoods, it just really hones in on the idea that the built environment and what residents have access to or may not have access to really plays a crucial part in shaping health outcomes among residents. So I guess the bigger question here is, so what? Why should other elements or other municipal departments consider health when it comes to a master planning process? Part of it is, in order for a master plan really to be successful and thinking about the implementation phase as well, collaboration is very key into thinking about how to have a successful master plan. And within this framework that I'm sharing here, parts of factors that go into a successful collaboration include identifying where pursued shared goals can be. And so by incorporating a social determinants of health framework across the entire master plan, you will often see that planning and design strategies that aim to improve public health outcomes may also advance other goals for other elements. And so this is an example for where those shared goals may result in additional co-benefits. So when you identify shared goals among other elements and make changes to the built environment, it creates, as you can see, a web of outcomes that benefits other aspects of the community, which can ultimately make it more livable. So in this example, we see, as we'll also see later on in survey results, Dedham residents really have identified that they really want safer infrastructure so that they can engage in walking and biking. And so by implementing policies that really aim to provide residents with safer walking and biking infrastructure and with health in mind, we really start to see the immediate impacts of positive health outcomes, such as increased physical activity and lower risks of traffic-related injuries. Additionally, you can also start to see positive impacts such as fewer vehicle trips and land that now is available to be repurposed for higher priority use, such as parks or business development. When we start to examine the intermediate impacts and long-term impacts, we can start to potentially see improved air quality and greenhouse gas reduction, increased foot traffic for local businesses, and then long-term lower rates of respiratory illness and lower risk of health impacts related to climate change. So as you can see here, in addition to not only achieving transportation and health goals, we also see potentially co-benefits for economic development, parks and rec, and environmental health conditions. And so the final consideration that I want to hone in on as to why we should consider health, and really circling back to the definition of the World Health Organization for health. Health is really so much more than people just not being sick. Health really starts long before illnesses. It starts in our homes, our schools, our communities, our jobs. And illnesses that we often see people experience are really just the tangible and visible examples of health. But oftentimes this really is just the tip of an iceberg. And when you really peek below the surface, you really start to see multiple factors and scenarios that really led up to these illnesses presenting itself. And so when we start to create and improve communities that really ensure everyone has an equal opportunity to be healthy, you ultimately create livable communities for all residents. I'll pause there, see if anybody has any questions. And Josh and Carolina, I'll rely on you to see if there's any comments in the chat box, but.
Yeah, I don't see any yet. And if anyone has, if you have a comment, it looks like Andrew has a comment, so I will go ahead and unmute you.
Diane, you're raising your hand as well, so we'll get you next.
I was wondering, I mean, this bears on for me both the governance discussion and also the natural environment discussion, but of particular point, we don't have anyone, as far as I know of, from the Dedham Board of Health here. And one of the things I have been wondering on this topic is whether their experience over the last few months has indicated to them that any changes in bylaws or other forms of governance would be helpful to them for future pandemics, should there be any future pandemic. Well, inevitably there'll be something. So we have a golden opportunity to learn from experience, it seems to me. And we have the experience right now. So if we haven't been reaching out to Leanne Jassett and the other Board of Health people, we certainly ought to be.
That is a great question. And before this, I was actually able to connect with staff from the Public Health Department as well as members from the Board of Health. And you read my mind, there will be a section later on in this presentation as it relates to governance and sort of the implications for the Public Health Department. Any additional questions before I move on?
There's one that just came in from Margaret in the chat, which says, I'm wondering what data you've collected about health outcomes for the town.
Great question. So the Norwood Hospital recently, I think it was in 2019, they recently completed their community health needs assessment. And in the community benefit service area for the Norwood Hospital, Dedham is one of the municipalities. So existing conditions as it relates to chronic diseases such as obesity, heart disease, lower respiratory disease, mental health for youth were all reviewed within that community health needs assessment. So that's one source of data that was collected. Department of Public Health has a tool called the Population Health Information Toolkit, I believe. And from there, information was also pulled as it relates to Dedham around several different factors, again, relating to chronic diseases. I'm hesitant to highlight that data just because that data is a little bit backlogged. I think the most recent data might be 2016, maybe even 2014. And because it's a little bit outdated, it might not be a representative snapshot of Dedham.
Diane, go ahead. Just ask.
Hold on. Sorry about that. Two data sources that I would like you to know about if you don't already. The Tufts Health Plan Foundation has funded community profiles on health, very detailed reports on healthy aging for the population of over 55. If you don't know about that, you should. It's 2018 was the latest. So there's a lot of data on Dedham for that. And also, it was interesting that you talked about Norwood. Beth Israel Deaconess in Needham. Dedham is one of the 4 towns that they serve. And we have some community level data from Dedham that you should definitely get your hands on. And if you need to get access to that, I'm on their community benefits advisory committee, so I can help to get that data for you. They're a new player for us. And then one other comment, you may already know this, but we have a age-friendly communities initiative here in Dedham, which is called Livable Dedham, and several members are on this call.
Great, thank you.
And it looks like the only other comment we have is Margaret did clarify that she's wondering about the rate of mental health needs and asthma rates, including life expectancy.
So that is a great question. I don't know that off the top of my head. I can definitely get back to you as it relates to that, and especially thinking if with actually the Beth Israel Community Health Needs Assessment and if that's included in there as well.
If I may, I think Sarah, I don't know if it was a comment or a question.
Yeah, just a quick question. I'm just curious if you think about public health goals or outcomes on a longer time frame than some of the other master plan goals. It would seem to me they come after, in some cases, we make other changes. So if we're thinking about how to measure our success, what time frame do you actually start to see progress on the health indicators?
That's a good question. So I think moving into this, in the field, it's called logic modeling. And so there are different sort of standards when you sort of think of immediate impacts, I think like potentially up to 1 year, intermediate impacts like 3 to 5, and long-term impacts potentially 5 and later. And I think that really sort of depends on when you think about what indicator you're looking at and sort of what data sources are available to provide data as it relates to that. And so, for example, potentially asthma, and thinking about how providing infrastructure to support walking and biking and how that affects air quality and then potentially asthma rates. It becomes a question of what hospital data becomes available, how timely that's made available. And so I think it might depend when you consider what health metric you're looking at.
Thank you.
Shaw?
Okay, hi, Elaine, Shaw McDermott, how are you? So I have several comments I wanted to give you by way of information and also potential sources for data and collaboration. First, as you may know, Walden Behavioral Health has just taken over the facility in the Dedham Corporate Center, which is dedicated to evaluation on a residential and I think an outpatient basis for various eating disorders. And I would think that they should be a collaborator with us in this process in some fashion once they're underway. Secondly, the Harvard Medical Faculty Physicians, on whose board I've served for 15 years, actually employs all the physicians in the Beth Israel system and has established various places for treatment, including at what is denominated the New England Baptist facility, but it's actually a joint facility because the Baptist is now part of the BI system. And they're expanding the kinds of care being provided. It used to be mostly joint oriented, but obviously joint maladies are often related to the underlying conditions which you've indicated, particularly in older populations. They also are going to, HMFP, Harvard Medical Faculty Physicians, is starting an urgent care facility in Dedham. And so I can certainly be helpful in getting some collaboration there. I've also been on the board, various boards of the Harvard School of Public Health. And I think they would be a tremendous resource for us in this study in due course, if you want me to help out on that front. Finally, I just have said earlier, and I continue to emphasize, I think the Dedham corporate area is going to be a major center in due course with transformation of various facilities, or could be so, for biomedical sciences. So we ought to look at how we are attuned to what they are doing, what is happening on the economic development front for purposes of assessing how we can encourage public health oriented opportunities in that area. And finally, it occurs to me that we ought to be trying to reach out and making collaborations with the various large scale vendors. Of course, the big supermarkets like Star Market and Stop and Shop, but also Roach Brothers, which are have facilities located within 1.5 miles in 3 directions from where I'm sitting. So I think that's going to be critical to helping our population in this town, but others as well, to get these stores kind of attuned to quality offerings and perhaps even distribution of information that emanates from our studies. And then finally, there are specialty shops that are located both within and just outside of the town boundaries. I speak of Tutto Italiano, for example, which is actually technically in Hyde Park, but is a great proponent of healthy eating in various ways and accessible to populations all over Dedham, but also located in some of those communities where you say there are great differentials in health outcomes. So, I mean, to sum up, I think there are potential collaborations that emanate from our town and nearby places that we ought to take advantage of.
Thank you so much, Shaw. Hopefully you got all that, Elaine. A lot of data resources, more than I knew. So a couple more comments. Nate, I didn't know if you wanted to expand upon what you mentioned about getting access to outside. And I think Margaret had some comments on mental health services for children. I don't know if anyone want to expand upon that. You just want to leave it as a comment.
I'm happy to. I was just saying, I think most of the time when we look at stuff like walkability and whenever you see the distance to parks and bicycle routes and all those other things, we think very much in terms of in ideal conditions in summer. And I think, you know, somebody who has little kids, when it's raining, when it's snowy, the opportunities for outdoor activities goes way down.
Mm-hmm.
The things that a town can do to support public health, right, is access to outdoor space and activities. And I think it is something that a master plan could just think about whenever we're looking at those amenities, to think about what they look like in the summer, but then also what they look like in the winter. And you know, even stuff like, you know, there's the big issue here that people aren't required to shovel their sidewalks, and it's impossible to walk to the bus stop from, you know, I only live a couple blocks from a bus stop, but you couldn't, my mother-in-law couldn't walk when she's here or something. So anyways, that was all. Just I think some of the things that we already are looking at could be looked at in terms of seasonality, because I think a lot of depression and the negative health outcomes are increased in the off season, if you will.
Thank you, Nate. Margaret, anything to add?
I just added in the comments that I know mental health resources, especially for children, despite being close to Boston, many families will report long waiting lists, even when you have insurance to pay for it. And I think Shaw's comment, I think we're ripe for more services. I also wonder, I don't know if we have enough data to really know the impact of public health on our communities. I just also put in the chat, like how many families are accessing Dedham Food Pantry pre-pandemic and now pandemic, during the pandemic, to see what the increase was. Are there certain times of the year more families are accessing the Dedham Food Pantry pre-pandemic times? So what's the impact of food insecurity in our community? How many families are also being evicted pre-pandemic? Or what's the impact of loss of housing on public health and health? Mental health needs of the community. I think also our closeness to Boston makes me also think about, and at times we've seen small populations of homeless folks in the community, alcohol use among our youth. I wonder if we should also consider looking at the youth surveys that have been done by the schools on health, which I'm forgetting the name of. But yeah, so it indicated in the past increased alcohol use among our youth, increased marijuana, increased vaping, and what's the impact of some of those decisions on long-term health of our community, which I'm sure vaping use has gone down in the pandemic, but once we emerge and students have more access, we tend to be a town too that's increased. We continue to increase our alcohol access through additional licenses. I know there's some consideration of additional liquor stores in the works, maybe. I haven't kept up as much on that. And I'm wondering what the increased access to alcohol is on our youth. And I guess I was going in and out, but.
No, we heard all that. Thank you, Margaret. And so Josh, thank you for letting us know the Metro West Adolescent Health Survey was the one that Margaret referenced regarding the survey at the schools, or the school level. I hope I got that right.
Great, thank you everyone. All very helpful feedback and sort of alludes to additional topics that will be covered later in the presentation and just a plethora of additional data to consider for the public health and livability element. So moving into the next section, I just wanted to quickly summarize some of the survey results from the topic area survey. This was the second community survey that went out to Dedham residents. And as a reminder, I believe a total of 779 people took the survey, and questions as it related to the public health and livability element. We asked what concerns do you have for the health of you and your family, and there are a bunch of different options where participants were asked to rate if on a scale of most important to least important. For the top two concerns underneath most important includes safety when walking and biking and access to recreation areas for exercise. So sort of themes that we've already heard from the steering committee and sort of Dedham residents, but sort of also another indication that Dedham residents really are concerned about how the built environment are really creating barriers for them to engage in health promoting activities. So we also asked what master plan topic is most important to you. Public health and livability came up at top, a close tie with community services and facilities. And I think there are some implications as it relates to why those two might have been the top two. And I think just given the current context in light of everything with COVID, it highlights an additional importance for public health and livability. And then we also asked for the livability aspect, what does a livable Dedham mean to you? The number one option selected was, again, neighborhood with access to life, work, and play. And so sort of Dedham residents, again, understanding that the built environment does affect their everyday life. And I do want to draw your attention to this other portion, even though it was a small number of people who selected this option, they were provided an opportunity to sort of provide comments as it relates to what a livable Dedham really means to them. And upon reviewing those comments, it included several responses really around the importance of transforming Dedham to be a more inclusive community that serves and welcomes the diversity of residents from all races, ethnicities, and age, with representative leadership to advocate for them. And I think this was important to highlight, just given the current context with everything that is going on with Black Lives Matter, police reform. It is important to think about where there are opportunities within the Dedham master planning process and future processes to engage more residents who feel like they have not been heard by town leadership, and sort of think about how Dedham can create more opportunities to engage in decision making. And I think this is just really important because in the end, when these opportunities are not created for residents to engage in, this is where we can actually potentially see an equity issue and ultimately lead to health inequities across, like I was referring to, different populations earlier on. And so the last question that was asked for the public health and livability, we just provided an open response for people just to provide any additional reflections on the topic of public health and livability. And these were just direct survey responses from this question. I just pulled out a few. There were a few questions or comments referring back to what I just had presented around the common theme of transforming Dedham to be a more inclusive community. Some comments around the youth and sort of thinking about where more actual upstream prevention work can be happening within the schools. So thinking about substance use, vaping, and alcohol, and providing actual evidence-based intervention programs for youth. Common theme of green space, diversity, equity, and inclusion. And then there were several comments as it related to the aging population within Dedham and sort of older adults. And this is also backed with just conversations I've had with stakeholders, just the need to sort of think about how to better serve the older adults within Dedham, especially with the projected growth of older adults within Dedham. So thinking about where services can be provided for older adults, upgrades to current senior housing, and programming to really connect older adults. So next section of this presentation, a lot of this will be a review from other existing conditions.
Oh, appears we might have lost Elaine for a moment. That's not very good. Let me see. Fingers crossed she may come back soon. Her next section, if I can fill in what she was going to say, hoping that she'll reconnect, goes topic by topic and looks at the interrelationships between the public health topic and its overlap with others like transportation, economic development, and housing. So she's using some of the data which you've seen in some of those previous presentations, but then providing a public health lens for that data. Looks like we did lose her completely, so she's out of the meeting. She'll be back.
Josh, there was a question in the chat. If there was a parent component. Did you see that question? Margaret said, was there a parent component to the Metro West Adolescent Health Survey? Or I don't know if that was for Josh Donati or y'all of it.
That's for Mr. Donati, and thank you guys for your feedback on that. And I hope it wasn't anything we said to Elaine, right, Josh?
I don't think so, although this is the first topic this occurrence has happened, thankfully. So hopefully she just emailed me and said she's trying to reconnect frantically. So we'll give her a warm welcome when she gets back in. I know this is always stressful when it happens.
Well, while we wait for Elaine, anyone have a, oh, there she is. Never mind, we'll take a sec.
We just wanted to give everyone a break. It's been a lot of information. Grab a glass of water.
I prefer some nice healthy Cheetos.
Josh, I saw your message, and Josh Donati, I saw your message. It wasn't scrolling for me, so thanks for answering that question. Good to see you.
Oops, sorry, Elaine, I think we need to make you co-host again. Let me do that real quick.
I'm really sorry about that. It says I have unstable internet right now. So to lower the bandwidth, I'm gonna turn off my video and hopefully that is a little bit more stable. Really sorry about that. Can everyone see my screen?
We can, I cannot. All right, now it's working.
Perfect. Again, really sorry about that.
No problem. We all needed a break, Elaine, so it's good before we dive into the next section.
So sorry, before that cut off, like I said, I will be diving deeper into sort of the existing conditions that were presented from the previous elements and sort of making that extra connection to health. And so for the first one, I just wanted to focus on housing. Alex presented on sort of high level demographics within Dedham, with the median age being 43 and the 60 plus population projected to increase by more than 60%. As it relates to housing supply within Dedham, there is the missing middle, what he calls it, for these multi-units from 2 units all the way up to 19 units. And this sort of poses some barriers as it relates to older adults and even potentially younger working professionals. For older adults, the lack of ability to downsize later in life as a result of not having these missing middle units makes it harder for Dedham adults to find more appropriate housing as they start to phase out of their current homes. And additionally, with older adults really not being able to downsize, it reduces the turnover of single housing options within Dedham. And I think the additional thing to really point out with this last point is this last option can be also incredibly challenging if there are also no programs in place to sort of help facilitate older adults to be able to age in place. So programs to sort of help retrofit the homes to accommodate their changing mobility that older adults may face. And for younger adults, not having the option for these middle units creates sort of a barrier and sort of doesn't provide that stepping stone for them to transition to potentially single home units for themselves. And I just want to highlight, as it relates to cost burden by income level, low income residents really are the most vulnerable when it comes to housing. When you start to spend more than 30% of your income on housing, it really takes away on your ability to sort of prioritize everyday needs. And so when thinking about the connection to housing and health, stable housing is really essential component for good health because this is where individuals can live in a safe, affordable homes and their communities. And as a result, they can prioritize their health and really better manage their disease and invest in their well-being. And when we talk about housing, there are really 4 major components when we think about housing. So for stability, are people experiencing housing instability? So are they moving frequently or falling behind on rent or needing to couch serve as a result of not being able to afford housing? This really has some deep mental health impacts on residents. It can potentially have implications for interruptions for employment, education, social networks. The next factor is thinking about quality and safety. Are the homes up to standard? Are there potentially exposures within the home that could lead to other potential negative health outcomes, such as potentially, are there pest infestations, poor ventilation, which could potentially lead to asthma? And when we think about affordability, are residents able to afford housing without needing to make trade-off for other basic necessities, such as food? And then lastly, this idea of neighborhood, is it located in dense neighborhoods that allow them to easy access other amenities such as parks, transportation, jobs, or healthy food access? So for the next one, I wanted to focus on transportation that Travis presented on. And this is just a map of the current transportation infrastructure within Dedham. And I think the 2 things that I just wanted to highlight on this is that 42% of streets within Dedham don't have a sidewalk on at least one side, and that there currently is no dedicated bike infrastructure. And from survey results and sort of what we're hearing from Dedham residents, this clearly has some serious implications for the safety of Dedham residents when it comes to walking and biking. And when we look at a crash cluster map, and looking at crash data from Mass DOT from 2017, 18, and 19, we see that 60% of crashes involved pedestrians and 40% involved cyclists. 50% of pedestrian crashes occurred in locations without sidewalks, and all cyclists crashed occurred in areas without bike lanes. So again, serious implications when the infrastructure is not in place that allows for residents to sort of engage in healthy promoting behaviors such as walking or biking. And I think another thing I just wanted to highlight on this map is that the areas that are shaded in a light teal blue are communities that have been designated as an environmental justice population, which is sort of a measurement of the percentage of residents who don't speak English as their first language, a measurement of minority residents, and then also income. And so when you look at sort of where the cluster crashes have really occurred, it's either on the outskirts of within these environmental justice communities or even occurred within them. And that, again, precludes sort of implications around sort of where there are health inequities within Dedham. And this map sort of highlights where that is occurring. And so when you try to understand the connections between transportation and health, transportation really plays an important role on the quality of life for people. It connects people to social activities, economic opportunities, medical care, food access, education. And I think I really liked how Travis was trying to reframe or add an extra component to his transportation element, is that it's transportation and connectivity. And I think he provided a great framework as to sort of that transportation is not just a mode of how people get around, it's how it connects people to everyday life. And additionally, I think transportation, really influences people's health and the health of the community. For example, air pollution associated with traffic congestion, physical activity due to sitting in hours of traffic, traffic crashes really have a significant impact on people's health outcomes, such as chronic diseases such as asthma, obesity, heart disease, and respiratory disease. And I think this is where the investments in infrastructure such as sidewalk and bike lanes, trails, public transits, and other infrastructure that support physical activity can really result in improvement of individual and population health. So the next existing condition that I wanted to touch upon was economic development. And the one existing condition I wanted to focus on was the unemployment rates. When Jen presented on this, she included data from the 5-year American Community Survey estimate from 2013 to 2017. And that data sort of shows that, I think Dedham is sort of experiencing higher rates of unemployment compared to the Massachusetts standard. Since that presentation, I pulled some additional data from the Massachusetts Department of Unemployment Assistance, and this is from their August 2020 report, and this is preliminary results. And since COVID, unfortunately, we start to see almost more than doubled of unemployment rates within Dedham, the Metro Southwest Workforce Development Area, and then almost tripled for the Massachusetts unemployment rate. And I just want to highlight that even though this data is really just a snapshot of what current unemployment status is and is potentially subject to change, it is really important to sort of understand what are the health impacts for individuals who are experiencing unemployment and sort of what that means if unemployment rates continue to move in a direction that we would not like to see versus what it means when we revert back to what it was prior to COVID. And so with income and employment status as it relates to health, they're really important determinants of health. Unstable jobs or unemployment have been found linked to cardiovascular disease, high blood pressure, diabetes, mental illness, anxiety and depression specifically, insomnia, tobacco use. Went too far. And so I think I just want to hone in that during these, on top of these uncertain times, the worry of someone of how someone is going to support themselves and potentially even their family places an immense amount of added stress, and that can really lead to a variety of health problems such as these ones listed here. And so the next existing condition that I wanted to touch upon is that since I think Courtney hasn't presented on his element yet, I pulled data from a national database from the Trust for Public Land. And it's essentially just a national database that gathers information around access to parks. And I do want to clarify a definition here that in their data collection, they define parks as any of the following 3 criteria. So publicly owned local, state, or national park, trails, and open space. School parks with a joint use agreement with local government. And then privately owned parks that are managed for full public use. So with that definition in mind of what they defined as parks, from their calculations, 75% of residents within Dedham live within a 10-minute walk of a park. And then 13% of Dedham's town land is used for parks and recreation. And so the 10-minute walk is well above the national average, which is pretty great. This part for 13% of land use, the national median is 15%. So that does highlight some opportunities for thinking about where additional land can be repurposed for green space. And so, although the majority of Dedham residents live within the 10-minute walk, there are still neighborhoods in need of parks. So Riverdale neighborhood, which is the most diverse and has the lowest medium income compared to rest of Dedham neighborhoods, has one of the largest high need, which is this highlighted in red, need for a park. Other neighborhoods within Dedham that sort of exhibit a need for a park include the Green Lodge, Sprague and Manor neighborhood, and then Dedham Village sort of bleeding into Oakdale. So in thinking about specifically what green space and open space and how that is associated with health outcomes, research has indicated that access to green and open space is widely linked to increased levels of physical activity. And emerging research has shown that green space, really specifically in thinking about for adolescents, is a pathway for children and adolescents to engage in more physical play. Children and adolescents are more likely to use active transportation when getting to green space, such as walking, biking, and additionally, the green and open space really provides structured and unstructured play for children and can provide a space for where community pride, civic motivation, and social interactions can naturally occur. And I guess I'll end on community gardens, parks and trails have been found to be associated with actually increased neighborhood safety. And research has found that greening of vacant urban lots have been associated with decrease in vandalism and gun violence. So before I move into the next section and talk about governance, I did want to circle back to sort of the survey result and point your attention to where the arrow is, and that preparation for control of pandemics was identified as number 2 for the important category as it relates to concerns for Dedham residents. And so how does this connect to the master planning process? The next part is sort of thinking about governance and specifically the health department. And sort of thinking about how to prepare for future pandemics and potentially additional emergencies later on in the future. I think there are we need to take a step back and sort of think about where the value of public health is and sort of think about what the role of public health should be. And so at sort of a national level and actually at a state level, there's a sort of big push to sort of think about how can we sort of transform our public health departments into this 3.0 bucket. And so I guess I can just provide a little overview of sort of the transformation of public health. For Public Health 1.0, the top arrow, it really emerged during the 19th and 20th century, where modern public health really became an essential government function. During this period, governmental public health really systemized sanitation, improved food and water safety, expanding the understanding of diseases, and developed prevention and treatment tools such as vaccines and antibiotics. As well as really expanding their capacity in emerging areas such as epidemiology and lab science. And really due to the scientific and organization progress, it allowed for more comprehensive protection for the general public. Public Health 2.0 really emerged during the second half of the 20th century and was really heavily shaped by a report released by the Institute of Medicine. In this report, it really highlighted challenges faced by the American public health system, and public health authorities really were facing increasing demands with fulfilling their statutory requirements while providing extra safety net care for their residents. And so just speaking from a state level here within Massachusetts, with all 351 health departments, the majority of health departments are struggling to meet just their required statutes by the state. And so as a result of really actually being sort of still stuck in this public health 2.0, it really highlights an issue for an inability to meet existing demands such as emergencies and COVID in light of this. And so in thinking about how to transform public health into this public health 3.0, which is a new era of enhanced and broadened public health practices. Public Health 3.0 really goes beyond thinking about what a traditional public health department fulfills and moves beyond just sort of fulfilling their statute requirements and sort of starts to explore where cross-sector collaboration through sort of interorganizational, intertown, cross-sector cooperations can sort of be formed so that health departments can really start to implement more upstream public health programming. As thinking about how to achieve this, it really does require the leadership of someone who is willing to embrace the role of what we call the chief health strategist. And this is someone who really sees their role beyond just fulfilling what they are required by the state around inspections, regulations, although very important in considering how to protect the community, but really see their role as also leading population and community health promotion efforts through these cross-sector collaborations. And, so just referring back to, in light of COVID-19 and sort of thinking about how to prepare for future pandemics, it highlights the challenges that the Dedham Health Department faced during COVID. And as a result of sort of potentially operating within Public Health 2.0, it highlights capacity challenges such as not having enough inspectors to keep up with the demands of housing and new restaurants, the public health nurse being really stretched to capacity with contact tracing for COVID, additionally also planning for flu clinics for this season, communications within the health department. And so despite even all of these challenges, I think it presents a really exciting opportunity for the Dedham Health Department and Dedham to really think about how to move into this Public Health 3.0. And it's really prioritizing hiring a chief health strategist who will support and build the infrastructure for intertown communication with the Public Health Department. And so this is sort of thinking about the value of public health and what public health should be doing. in order to actually achieve that value and fulfill what public health should be doing, we need to think about the infrastructure within the health department. And so this is a model that is being adopted nationally and actually at a state level called the Foundational Public Health Services. And this in this infrastructure, it consists of foundational capabilities, which you see on the top in the big box. And these capabilities are cross-cutting skills and capacities needed to support basic public health protections and other programs and activities that are key to ensuring the community's health and really achieving equitable health outcomes. In addition to these capabilities that we see at the top, we see public health departments needing to really have a basic set of public health programs or foundational areas, which is what you see at the bottom. And these are basic public health topic-specific programs that are aimed at improving the health of communities affected by certain diseases or public health threats. And so this is included but not limited to chronic diseases that may be prevalent within Dedham, community disease control, environmental public health, maternal, child and family health, and then access to clinical care. And, you know, I think I just want to highlight, when looking at this infrastructure, it can be very daunting in thinking about how a town can sort of support the health department in building out an infrastructure like this, and it may seem incredibly ambitious to achieve. And I want to reiterate that this framework will definitely require that cross-sector partnership and collaboration, and even thinking about where potentially sharing services with neighboring municipalities may sort of help achieve this infrastructure. And so examples of this, of how the health department can increase capacity includes potentially thinking about where shared staff can occur. So thinking about the need for more inspectors, could that be shared across municipal borders? And so in light of COVID-19 and sort of fitting it into within this infrastructure, it really highlighted specific capabilities that needs to be built up, and when thinking about how to prepare for future emergencies, specifically around assessment and surveillance, emergency preparedness and response, the communication, and thinking about the specific areas as well, communicable disease control. Stop there. And so connecting it back to health and sort of how health departments sort of are connected to that, local health departments really are the frontline workers that provide public health protections in a number of areas, including preventing the spread of communicable disease, ensuring air and water quality are safe, preventing chronic disease and injury. And in addition to all of this, local health departments provide local protections and services that are really unique to the community's need. And really, in order for a health department to provide all these protections, the proper infrastructure needs to be in place to ensure that there are equitable opportunities for all residents to be healthy. With that, that's the end of the existing conditions that I wanted to highlight. I know that was a lot of information. I wanted to stop and see if there are any questions before we move into defining topic area goals. And I'll defer to Josh again to check the comments.
I think, Elaine, if you don't mind, what we should probably do is get into the goals, and then we can have further discussion in the quick breakout discussions.
Okay, sounds good. So with all the existing conditions, conversations with stakeholders, taking into account the survey results, are some preliminary topic area goals for the public health and livability element. And they are broken into 4 major buckets. So the first one is neighborhood and built environment. And a goal of that would be to facilitate the development and improvement of neighborhoods and built environments that are health promoting, connected, dense, and convenient. The next major area goal includes indoor and outdoor spaces linked with programming. So this would include designating existing indoor and outdoor spaces for physical improvements using universal design to provide intergenerational programming that strengthen community connectedness and promote physical activity. Next bucket is civic and social engagement. Create and facilitate civic and social engagement opportunities that allow residents to engage in town decision-making so they feel represented, welcomed, and empowered. And then the last one includes high-performing municipal public health system. Commit to creating a high-performing Dedham Health Department that leads and advances upstream preventative health programming to work towards achieving health equity. And so with those topic area goals in mind, I guess we can open it up for discussion and potentially break out into small groups of thinking about, are these goals close to what should be addressed for public health and livability, and do additional goals need to be defined?
Okay, so I think that we're just going to test out that model this evening as a different way to engage more voices in the response to these questions. So I'm going to set up quickly 4 groups. So we've got 20 participants right now, so 4 groups of 5 each. And then if you wouldn't mind, we'll stay in those breakout groups for just 5 minutes or so, and then we will conclude the meeting shortly thereafter. So just give that some thought, please, and react to the information Elaine has presented, and then we'll reconvene as a group after the breakout session.
Hey, Josh, just quickly, will we all be able to see those questions in our breakout groups or the goals?
I will try to put them into the chat, which you will be able to see.
Perfect.
All right, so you're being assigned randomly and automatically, so off you go. Please discuss nicely.
You'll see little pop-ups that ask you to join the breakout room, and then when it's over, there's a pop-up to leave.
Welcome back, everyone. So we're always trying something new. So we do welcome your feedback if you like the model, that model of discussion around the topic, and prefer it to what we've done in previous sessions. We're always looking ways to improve these Zoom meetings. If anyone would like to share a particularly interesting thought that occurred in your small breakout group, we would welcome that. We'll give a couple minutes to that if anyone would like to share whatever you'd like.
We were lucky. It was our group was Elaine, Shaw, and Sharna. So we were lucky enough to have the expert in our group with us. But we talked a little bit about reordering those goals, just to put the high functioning public health department at the kind of as like the #1 goal, particularly since that is, I mean, they all obviously link with the other domains, but that seems like that should be the focus. And then had a good conversation around kind of how, even just in terms of like changing job patterns, how that's going to impact it, how we're preparing through high school for those changing kind of job patterns, and then also calling out climate change in particular, and helping people understand the connection between what climate change is going to mean for public health.
Great, thank you, Jessica. Any other thoughts? Yes, Andrew.
You have to let me unmute. All right, now we're in business. Since Margaret was saying that she couldn't unmute, I'll say that she was particularly saying in our group, I think, and most of us concurred, or maybe all of us concurred, that she felt like we had a lot of good information that we needed to digest in order to make the thinking more specific to Dedham's needs rather than somewhat generic. It wasn't clear exactly how much of what we have so far is focused on Dedham in particular. I would say in our group, we had some discussion of the third bucket. Maybe this is just my incapacity, but it was, we had some discussion. Margaret had one take on what that meant, and I had another that I was having trouble making sense of it. And to the extent that it may be unclear what is it to be included in it, maybe it could be refined or clarified. Oh, Diane, Jim, do you want to add anything to that?
I think I've adjusted the settings, so you can all unmute yourselves now. It looks like
Okay.
we're a safe meeting.
Okay, thanks. I would just say that I agree with what was in the chat about making public health leadership more prominent. I think the presentation made the case that public health is connected to economic viability and so many other things that we value: housing, transportation, and it needs to be connected to all those things. So in so much that the master plan can help to do that, I would really welcome us moving towards that public health 3.0 model.
I think Andrew's point is well taken, that maybe that third bullet needs some wording that allows it. I really understood, I have a vision of what that community health looks like when we're all civically engaged in promoting the health of all of us, right? As an individual, if I have a mental health need, I work to resolve my need. But if we have a mental health need as a community, we all work together as a community to provide resources and funding and support for each other when we have mental health needs as a community. But I think Andrew's point that that third bullet may not clearly articulate that community-wide public health, that we want our public board of health also to have that vision for.
Yeah, I was maybe improperly zoned in on things like community efforts to resolve isolation and encourage social engagement, that I was having trouble seeing how, as a municipality, we could sort of interfere in people's social lives in that way. Maybe I just wasn't getting it.
Any other insights anyone like to share?
In our group, it was Justin and I think interestingly, we came up with some similar, I guess, notions. Like we sort of felt that, you know, the first three again, yeah, were sort of integrated into all of the elements of the master plan, and maybe the last one was really should be sort of the star of the show and maybe expanded on more in this element. And then there was, I guess we both would like more time to digest a lot of this data. A lot of it's new to us, so it was hard to react in such a quick time frame. And then what else? What other? I guess there was just sort of a lack of understanding on my part of what is the actual role of a health department in a municipality. You know, what's the actual purview, and how can we, you know, what's the best way to, I guess, you know, facilitate that department being functional and as good as it can be. And what are some things that might not be in the purview of a municipal health department? Even though it might sound grand, we don't want to just put things in there that might not actually be able to be affected by a public health department, or might just be, you know, require too many resources. So I guess I just didn't understand where that line is. So.
I think that's why we were sort of talking that the fourth bullet point might want to rise up in priority, because the other three did seem to weigh into other topic areas and be the way that something that we should be thinking about as we think about other topic areas. But the fourth one was, you know, seemed very specific to public health department and can be broken apart, possibly, you know, broken down a little bit more for us to better understand and to, you know, that we can then sort of better put together guidance or future thinking.
That's all really helpful feedback. I guess just another question I just have for the group, just any additional goals that were discussed that might not be included. I know Jess mentioned climate change and sort of thinking about where that can be integrated into the public health and livability. Just curious if other goals identified potentially goals that are not, you don't see potentially falling underneath what has been drafted.
We didn't talk that much about emergency preparedness. I feel like that is important. I guess not as you don't feel as much of at risk here in Dedham as maybe other coastal places, but it seems like there are lots of big, powerful storms that have been coming.
Thank you. Josh, I don't know if I want to turn it back to you, just also trying to be mindful of time.
Yeah, I think with that, we'll say thank you very much for all the feedback. I did want to just touch very briefly as we close up on next steps, but I can just do that verbally, Elaine. So thank you all for attending. So you will see soon the one-sheeter draft for economic development and transportation, and we'll give you a time frame that we'd like you to take a look at that when we send that along. And then we'll be discussing the next topic on November 17th at 7 p.m., which is our next committee meeting. And that will be natural, historic, and cultural resources. And we'll be joined by Courtney Lewis on that meeting and discussing with him that topic. So we look forward to that. And then we'll also be arranging between now and then, our next meeting, we'll be defining and arranging ourselves for outreach, defined around the 3 workshops, the community open houses, which are forthcoming, which we described this evening. And so you may hear or see an email from us about that type of outreach. So we might have an ask related to that as we formulate that game plan in the next few weeks. So with that, I will again thank you all. If you do, you don't have to do it in this meeting, but if you do have feedback about those breakout groups, for example, if you really liked them or if you really didn't like them, if you thought they were too long or too short, any of that type of feedback would be helpful as we think about how we're going to engage as a committee moving forward. So you can send that to myself or Jeremy or Jessica or Sarah, any or all of us.
And ultimately, we want to make sure that, you know, we don't get into any set pattern, and that we're finding the best way to engage you, you know, as we get close to 9 o'clock. What's the best way to make sure that everyone's attentive and making sure we're providing with the right balance between information and discussion. So we're more than happy to hear your feedback and discussion on that. And so next meeting again, November 17th, same place. And we might do breakout groups, and I mean, I'd like to try it again, so why not? And anything else, Josh?
Nope, that's it. Thanks, everyone.
Thank you for a great turnout, everyone, again.
Great to see everybody. Thank you. Thanks,
Thank
Elaine.
you.
Really
Yeah,
appreciate
my
all of
pleasure.
the work you did to pull that data together. It was really great,
My pleasure.
really helpful.
Thank you.
Good night, team.
Good
Good
night.
night.